All right. Hi, everyone. Welcome to Maddie's Fun's Community Conversations. We are so glad you can be here today and to wrap up our calls for 2025. I'm one of your hosts, Sheila Kukan, and I'm really excited to be here with Deborah Olmedo, a snow person that's joining us today. Thank you, Deborah, for being in such good spirits. This is so fun. Deborah is a registered veterinary technician with more than 15 years of experience and a deep commitment to ensuring communities have equitable access to animal care resources. She grew up in Central America and is a native Spanish speaker, bringing valuable cultural and linguistic insight to her work. A graduate of California State University, Los Angeles, with a degree in anthropology, she approaches animal welfare through a community-centered and culturally informed lens. And I have just been so pleased to host this month with you, Deborah. Thank you, and thanks for coming back.
Thank you all for having me. I think I am now eligible to add to my bio official snow person. And for those that were not here last week and are wondering what the heck is wrong with me, Sheila said, let's dress up next week. And I said, bet. And here I am. Again, thank you all for having me. And I want to start us off with the question of the day. What's one thing an animal has taught you this year? Sheila, do you want to start us off as I
Ooh,
kick this off?
yes, actually, that question, I love that question. It's been an interesting year for me. For those who don't know, my dog Ziba is going through her cancer journey, and she's definitely taught me a lot this year. And something I was thinking was that she's definitely taught me how to trust the process and how to be patient and just how to be very present in my day to day. So I'm very grateful for that. What about you, Deborah?
I was actually gonna also share what Siba has taught me this year, if that's okay. And it's acceptance. I feel like oftentimes things happen to us and we're so quick to like, what are we gonna do? What are we gonna do? We're like reacting. And Ziba has really just taught me to like, it's okay. But I will share some other questions, or answers, excuse me. Patience, yes, that is my new kitten has taught me a lot of patience as well. Um, Amber, Bambi taught so much about how much my partner does for care for animals and how much it moved and how much you're both stronger than you realize. Yes. Kristen had her first FELV positive cat and really has learned how to advocate them. I love that. Uh, Puppies are a lot of work. Yes, you forget. It's like when you have like older pets and then you have a kitten or a puppy, you're like, oh, this is hard. How to adapt and how to adjust to new circumstances. I love that. A reminder to have fun and be in the moment. I think that is like we all know that we're in it for animals, and then questions like this really make you realize exactly how much they help you, even though we think we're helping them. So yeah, to cherish every moment. All right, let's move on before we start crying. We're talking,
Oh,
yeah, come on.
it's
I can't cry in a snow person outfit.
You'll melt. I love this. Thank you all so much. Keep them coming in the chat. And if you have any national updates, please feel free to drop those in the chat as well, and we'll share them on Maddie's Pet Forum.
I think I should introduce our presenters today. I'm really, really excited. We have three, so I'll get started with some bios. First up is Dr. Chumkee Aziz, is a first-generation Bangladeshi American. She received her DVM degree from Tufts Vet School in 2012, completed an internship with the ASPCA in New York City in 2013, and then a shelter medicine residency at the UC Davis Koret Shelter Medicine Program in 2016. After her residency, she worked for the Austin Humane Society and the ASPCA before returning to work with UC Davis as a shelter medicine consultant. She is board certified in shelter medicine practice through the American Board of Veterinary Practitioners and serves on the ABVP's Shelter Medicine Specialty College. She also served on the Association of Shelter Veterinarians board from 2017 to 2020, and she's helped author the ASV Guidelines for Standard of Care in Animal Shelters, I was gonna say AHA, Canine Vaccination Guidelines, and publications on vaccinology and shelter feline housing. Her professional interests include supporting shelters and helping their community access care and managing infectious disease outbreaks. And she still has time to enjoy doing spay neuter and street medicine clinics in her native hometown of Houston, Texas. And she loves birding and movies. Next up, we have Dr. Lucy Fuller. Lucy Fuller joined the Charleston Animal Society in 2008 after she graduated from vet school at the University of Georgia College of Veterinary Medicine. Under her direction, the Charleston Animal Society Spay Neuter Clinic has expanded and become one of the largest spay neuter providers in the state of South Carolina. In 2013, Dr. Fuller completed her master's certificate in shelter medicine through the University of Florida. Dr. Fuller performs thousands of surgeries each year, most of which are spays and neuters. She also leads the shelter health team. Additionally, she is active with No Kill Aziz, the organization Shelter Outreach Program that aims to reduce unnecessary euthanasia across the state. From 2015 to 2025, Dr. Fuller served on the South Carolina State Board of Veterinary Medical Examiners. She also has served on the board of directors for the Association of Shelter Veterinarians and was a co-author of the ASV Guidelines for Standard of Care, second edition. Lastly, but surely not any less, Dr. Biana Tamimi. Dr. Biana Tamimi is a director of shelter medicine at the Animal Care Centers of New York City, New York City's open admission shelter, and one of the largest animal welfare organizations in the country. Prior to this, she completed the ASPCA's Julie Morris Shelter Medicine Residency Program in 2024 and is board certified in shelter medicine practice. Alongside her work at ACC, she also co-lead, for the Street Dog Coalition team in New York City, providing accessible care to unhoused people and their pets. Please join me in welcoming Dr. Aziz, Dr. Fuller, and Dr. Tamimi.
Oh, thank you so much. Hey, thank you to everyone joining us today. And thank you so much to Maddie's for having us. I wanted to share some experiences from two shelter vets who are like living the life every day of Parvo and get that out there in the real world. We have newer publications about Parvo treatment with CPMA, what that looks like. And so I really wanted to have Dr. Fuller and Dr. Tamimi talk about that. So just as a very brief intro, CPMA is a relatively new product from Elanco, and it stands for Canine Parvo Monoclonal Antibody. And the reason it is like a huge deal in veterinary medicine is because y'all know this, for decades, right? We've only been able to treat Parvo supportively. And this is the first time in our history that we have a targeted treatment. So what I mean by that is CPMA binds Parvovirus particles and it binds it up. So actually Parvo can't enter the body's gut cells, bone marrow cells. So it's truly a targeted treatment, first of its kind for us for Parvo. So such a big deal. Amazing. If it was cheap, it'd be even more amazing. But we're going to talk about that because there are, of course, logistics to it and the practicalities to it. You know, like how do you pick dogs for treatment? What do you do with the cost? Is there a good cost trade-off? So Dr. Fuller and Dr. Tamimi are going to talk about that with us today, what it looks like in their shelters, because they have very different shelters, and like what that means for length of stay, what that means for cost, what that means for staffing dedication. So Dr. Tamimi and Dr. Fuller, anything else to add before we jump into questions? Actually, how about this? Will y'all give a very brief profile of your two shelters, like what type of shelter and annual intake, just something really brief. I know that Maddie's team introduced your shelters, but just briefly.
Sure, I can start. So I am the director of shelter medicine at the Animal Care Centers of New York City. We're an open admission shelter, and we take in about 20,000 animals a year. That includes dogs, cats, we get wildlife, we get birds. We currently have like 40 chickens with us, rabbits, guinea pigs, kind of anything that really would walk through the door. Dogs, we take in 7,000 dogs per year across the 5 boroughs of New York City. We have 3 current shelters, so those dogs are housed across the 3 shelters. And just to give you some insight into our parvo numbers, we get like 2 to 5 parvo cases per month per shelter, I would say.
Thank you.
I'm just sitting here doing math, as we all do when we compare. So I am in South Carolina, North Charleston, South Carolina, and we have two campuses now that we're managing. So our main campus in North Charleston has an intake of about 10,000 animals a year. It's about half and half dogs and cats. And then we have another campus that we've added this year. We started managing in a neighboring county. And they take in about the same number of dogs as we do, but fewer cats. And most of the cats are returned to the field instead of coming into the shelter. So still, pretty large number of parvo cases. It does vary a bit, but I would say we have anywhere from 1 to 2 a month. And if we look at parvo and panluke, it would probably go up to like 3 or 4.
All right, let's jump in. So we have a list of questions we thought would be valuable to share responses to with y'all, but please put your questions in the chat. And of course, at the end, the Maddie's team will facilitate a Q&A. So please feel free to ask as we go along. Okay, so first and foremost, Dr. Fuller and Dr. Tamimi, what's been the most important factors guiding your decision to try and use CPMA versus just, traditional parvo supportive treatment? Like what led y'all to start using it? Anyone can go first, please.
Well, I think we were interested. We're lucky in that certainly everyone has budgetary restrictions, but for us, if this was something that we felt would really be beneficial, we thought that we could justify the expense. So I think everyone knows that hospitalizing and caring for animals with parvovirus and panleukopenia is a significant cost undertaking because of the labor, because of many things. So adding to it seemed a little daunting, but it sounded really, potentially very helpful. The number of animals that we saved prior to using CPMA it depends on the year, but it's above 80%. So it's a good number. Like we didn't have a lot of animals dying. We're receiving, just the typical supportive care. But of course, we struggle, like many people do, to isolate them properly because that was not something that we had planned our shelter around, unfortunately. And so, we were looking for anything that would really help with the treatment, maybe make it less intensive. And we were willing to try.
I think those are very similar reasons as to why we started. I wasn't around at the shelter when we did bring it on board, but I think it just came down to a conversation with the Elanco rep, and they were, the hype around it sounded like something exciting. We were interested in it, so we thought, why not go ahead and try it? We see so many creatures that come through the door, and I think anything that might help get animals to a quicker resolution. At the time when we started, I don't think we knew how it would impact shedding periods, which I think we'll talk about in a little bit. But something that might move these animals through and along, because our facilities were not built really considering parvo isolation. So we struggle a lot with isolation spaces, particularly our Manhattan shelter. There's not space for that. So we get creative. But I think, we were mostly just interested to see what might speed along the process to get these animals to their outcomes.
And I should have mentioned this too in my intro, but CPMA is conditionally approved for the treatment of parvo, and then even more recently has become approved for the prophylactic treatment, so to say, but basically as a prophylaxis for parvo. And so what that means is, say you get a bunch of puppies in, a litter in, one dog is parvo positive, very sick, you know that its litter mates have been meaningfully exposed, but they're not yet sick. You can now give CPMA to those dogs who have been exposed but not yet sick. You can give them CPMA at a half dose in a different formula, in a different route, and try to save them, protect them prophylactically from parvo. So that leads us into this next question, which is, how does your shelter determine which patients would be candidates for CPMA? And that question is now truly about like who gets treatment and also who gets prophylactic treatment. Because in my head, it makes sense. Like if I have the money, I would hit them all with CPMA if they're clearly positive and symptomatic. But the question around who to use CPMA on prophylactically might become a little more difficult to decide because, again, it is costly and you don't know if that animal is going to break or not. So it's a gamble, right? So if y'all will speak to that, please.
So typically the dogs that we have that are diagnosed with parvovirus, I would say the vast majority come in with clinical signs and we catch it at intake. Of course, I'm going to knock on some wood here. Yes, we do see cases that break a couple days after coming in. But the majority of animals that come in are strays. They have clinical signs. We'll test them at intake. And then we also get owner surrenders that have been quoted, $4, $5, $10,000 at other hospitals for care. So they already have a diagnosis, often when they do come in. And in terms of who we choose to administer CPMA to, like Dr. Aziz said, we don't have the hugest amount of funds to, spend for everyone with any clinical sign, but we will focus on dogs that are, I would say, moderately affected with clinical signs, typically lethargic, vomiting, inappetent. But these dogs are usually ambulatory. They come in, they look dumpy. Imagine the pity that's a little slow moving, looks a little sore in his abdomen. And we kind of gauge it as, is this animal stable enough to stay in our shelter? Because we are not able to provide overnight monitoring, intensive care, hospitalization. We don't have an ICU in our shelter. And so if that animal did require more intensive care to even stabilize, or maybe they don't respond to initial fluid therapy, those animals we would have to send off-site, but we are not in a place where we can do that for every parvo dog that comes in. So we are choosing the more moderately affected dogs. If they are severely affected, as in they're non-ambulatory, they're in shock, we think that their prognosis is really poor right off the get-go, those are cases that I wouldn't administer CPMA to because I think CPMA is not a wonder drug. It's not like you give it once and then boom, they suddenly start walking. So typically we wait for those dogs that have a better prognosis, and that we think that are going to recover at some point. And those are the ones that we focus on.
Sorry, wouldn't unmute. I think we're similar in many ways. And the way I sort of think about it is we use CPMA on the animals we choose to treat. So if an animal is so severely affected that I feel that euthanasia is the more humane choice, then we would not use CPMA on that pet, unless there was some other reason to try and intervene despite, the initial analysis of the pet. So in general, we're using, and so this is all the animals that we have diagnosed with parvo, we would use it on that we feel like we're going to treat and give further care. We also are using it prophylactically and have been for a while, and it's nice to hear that we can, give a lower dose, because that's certainly less expensive. And so we, in the past, we're also using it on, say litter mates, truly exposed litter mates who weren't that clinical, and we were happy with that. And so, trying to spend our money where we think it will be successful, because certainly it's all expensive, not just CPMA. The rest of it is expensive as well. But in general, we're similar to Dr. Tamimi's shelter. We're not able to do any overnight care, at least not having a person monitoring a pet overnight. And so if they needed that, then that might be a euthanasia decision.
Yeah, I just want to add, we also do administer prophylactically to any non-positive litter mates. That's really the extent to the prophylactic use that we're using at the moment.
And Dr. Aziz, I don't know if you want us to go ahead and talk about cats as well, because right now we're focusing on dogs, but in general, everything that we provide for dogs, in terms of the number of or like who we treat and who we don't treat and how we use CPMA, we're using it in cats as well. And so we make our selections in a very similar way. So if it's a Parvo kitten who's presenting completely recumbent and barely responsive because he has a blood glucose of 25, which happens regularly. I would say not regularly, but it happens quite a bit in the summer. If that's a kitten who's also positive for panleukopenia, then that's probably not a case that I would treat and use CPMA unless they recovered very quickly from initial intervention. So we're trying to use it on ambulatory, just not feeling well animals who we think we can save.
And actually, that was my next question for y'all is, are you using it in cats? How did you determine to start using it in cats? And just as a side note for folks out there, because CPMA is labeled for the use of dogs, in dogs. And so its use in cats is considered extra label at veterinary discretion. I will say, side note, that Elanco reports that they are looking into it in cats. Hopefully we'll have a publication about it soon. Because they don't have any published studies on it, they can't speak to its efficacy. But I did hear through the grapevine that there are no concerns about safety. So if you could try, why wouldn't you try? But still, I think with new drugs, with new meds, sometimes we get nervous sometimes. But so I wanted to ask Dr. Fuller, I know y'all are doing it, if you could speak a little bit to its use in cats, and Dr. Tamimi, where y'all are at, if y'all are thinking about using it or if you've tried. Yeah.
Yeah, so clearly we're using it, and we started about 6 months after we did with dogs, and it was one of those things I heard from someone else who heard it from someone else that somebody was doing it. I mean, it's literally exactly what happened. And another friend said, yeah, she was talking to the Elanco vet and asked questions about it, and it didn't seem like there was anything really blocking its use in cats. Really, just it hadn't been tested. And so we tried it out. We had quite a high number of panleukopenia cases, mainly because we were spreading it in our shelter, which is another Oprah show, as they say. But we had a number to try it on, and I'm happy to report that it was at least not, we didn't make them worse, and we do think we had similar results to the dogs, it seems, at least for the year that we've looked at in data analysis.
We've not really used it that much on cats. We have started, I think, after talking to you, Dr. Fuller, at the last conference and some other colleagues about it. We had a particularly rough season, I would say. Kittens were just, there were so many, and the number of Panlo cases was really high. We did have to be a little bit more aggressive in terms of our euthanasia decision making, just because we did not have the capacity to isolate cats really in any meaningful or useful way at our shelters. So it was really case by case. We didn't implement any kind of protocol. It was just, where can we house this cat? Can we administer CPMA? Do we have it in stock at the moment? Um, and I would say, yeah, no adverse, impacts that we noticed. Again, this is really just a handful of cats that we used it on. Um, I am interested to keep doing so, and I think, if we can figure out our isolation and where we can put these guys, that will help us, be able to implement it a little bit more because, even though they have received CPMA, they are still sick. They are still requiring isolation. It's not a one and done fix.
So it's good to hear about the realities. The ISO, like it sounds like a big rate limiting factor here is ISO, right? And so I was going to share that a paper was just published literally last week in the Journal of Shelter Medicine, Community Animal Health about Parvo or CPMA use in shelter dogs. It was from Oregon Humane, and they found treatment duration was decreased in the population that got CPMA versus didn't get CPMA. And they found correlative to that cost of treatment was actually reduced in the CPMA treatment group because time in ISO and time being sick was shortened, right? So it made sense. Like if you have to treat them for less time, if they're in ISO less time, if you're spending less supplemental medication, if you're using less supplemental or ancillary meds on them, then it turned out cost of treatment was actually cheaper for CPMA group. So that was really interesting. But that also speaks to like, hey, does that mean less time in ISO? Because that would be terrific, right? And so Elanco has some initial studies that show that CPMA treated dogs have reduced viral shedding time, which is terrific. Because remember, like dogs with parvo, they still might have diarrhea because their intestines are messed up from the infection itself. But that doesn't mean they're still clinically shedding, or even if they are mildly shedding, it doesn't mean that they're necessarily significantly contagious to other dogs. So, figuring out like, do I feel comfortable moving this animal out? Do I parvo snap them again? What's that look like? But in general, it's helpful to talk about limitations around ISO, limitations around treatment space. And also, I just wanted to ask too, I'm going to skip around in our questions a little, like, what are some other barriers to integrating CPMA into your treatment protocol? So it sounds like space is one. What else would y'all say?
Well, at least theoretically, the recommendation that it be frozen and then any, that you don't use for this individual patient be thrown away. Although we have refrozen it and used it with at least no ill effects. It's hard to be sure, without like more data, how well it works. But I think that's a big one for people is, they have a bottle that treats, especially if they're looking at treating cats who are typically, 2 pounds or less when you're treating them. You're going to open a whole bottle for a 2-pound cat, and then throw the rest of it away. So I think that that can maybe be a barrier for some folks. Maybe they have a whole litter and it makes sense and they can open the one bottle, but I could certainly see that being a barrier. And I think it is for us as well. So the staff was like, well, I'm not throwing this away. I'm just going to refreeze it. And then, 6 months later, I realized that's what they're doing. And I'm like, oh, okay. So we've been doing this the whole time, so it's a standard thing. I think this kind of thing happens everywhere, but it at least has not been dangerous. That's the best I can say. But yeah, and then, when it comes to like our second campus, I think if right now we don't have veterinarian stationed there on a regular basis. And so really hospitalizing anything is a challenge. And so, we would transfer to our main campus, and then do we already have something in isolation there? So again, it's back to housing and really the challenges of having enough space and time. that I think are similar in many places.
Yeah, I think that's the primary challenge that we have is around housing. I wish that we had more on-deck medical fosters that could, take sick dogs, and then we can do like an outpatient treatment kind of protocol. That would be great to be able to just remove them from the shelter and avoid the risk, or minimize the risk to the shelter population. But right now we are really just finding nooks and crannies and where we can stash a dog for a little while. And uh, I think that is probably the biggest deciding factor as to how long we can house a dog at the shelter for. We really rely on our rescue partners to pull these dogs. And I will say that, probably rescues are the ones that we work with the most. They're aware now that we're administering this treatment, and it seems like they are potentially at times more likely to pull dogs that have been treated with CPMA, but it's still quite an early drug and a young drug that I think the word isn't totally out there. But we just do what we can to try to pull these dogs as quickly as possible. Because again, that isolation space, can we house this dog safely in our shelter, um, is the biggest deciding factor of how we integrate it.
And thank you. Just so folks know, like we see your questions coming in and we're definitely going to have time to get to them. So thank you. Please keep putting your questions in the chat. For both doctors, so what are y'all seeing? Like what kind of outcomes are you seeing with CPMA use, either data-wise or anecdotally, especially compared to um, in previous years where we just didn't have CPMA? What are y'all seeing?
So, I'm really happy that this Parvo, this canine article came out recently because we have very similar um, results from cats. I mean, we don't have as much data on dogs. I don't know that I can make like a really great statistical analysis of CPMA to non-CPMA dogs yet, just because our total numbers are not as good as they were with cats. But in general, so what this newly published article shows is that, as you said, Dr. Aziz, the number of treatment days is lower when CPMA is used on average. And so that leads to a decrease in the cost of care overall. So we looked at, for us, it was, I think, $100 on top of a typical cost of care. It was $100 a day for us to hospitalize a patient. It's kind of as an average. And so if you're looking at 3 fewer days, which is what we found for our cat average. So it was taking 9 days to treat cats before, and then it took about 6 or 7, more towards 6, after we started using CPMA. So we're saving about 3 days of treatment. So if you look at that as a dollar sign, that's $300, which is incidentally about the cost of a bottle of CPMA. So, and if you're using one bottle for a whole litter, then you're actually saving money there and not just breaking even. Certainly when you look at a larger dog, the cost may not be quite the same, the savings, but not everything is about cost. So in general, what we're seeing is animals are resolving their worst clinical signs more quickly and getting to the point where they're eating, their diarrhea is controlled, and they don't need daily hospital, IV fluids or those daily IV meds that really take the most time and energy.
I would agree with that. That's definitely what we're seeing as well. We see clinical improvements, 1 to 3 days after administering, bearing in mind that we're also giving supportive care, we're also doing fluids, and, is it the CPMA or is it the supportive care that now they have fluid in their veins? Um, and so I don't have, exact facts and stats on exact numbers, but anecdotally, I think the most pronounced change that we're seeing with CPMA is the reduced shedding period. Um, by day 2 or 3, I would say these dogs are eating, they're brighter, and then the shedding period before CPMA, I would say would take about 5 to 8 to 10 days to resolve. And then with CPMA, we're seeing a resolution of the shedding period after it can be anywhere from 2 to 4 or 5 days. So that is like it is marked for sure. And the way that we resolve cases, we will do a fecal antigen snap test once clinical signs resolve, and then we will repeat that 24 hours later. Um, and so we can get these dogs out and moving by day 3 or 4. And that is a huge help for us. Again, we don't have isolation spaces. We have rescues that are very willing to take these dogs, especially if they have a negative SNAP test. So it just shortens their length of stay with us pretty significantly. I think that shedding period, as we were saying before, if you have a dog that is shedding parvo in the environment, contaminating things, contaminating hands, floors, everything, the risk to the shelter population is so high, especially if biosecurity measures are challenging. I would say in our shelter we have some challenges, but anything that can shorten that risk period uh, will help.
Oh, that's really good to know. That's really helpful. And before we launch into the audience's questions, one last question from me, which is, so there are some shelters who have put in the chat today, they haven't tried it yet. What advice would you give to folks who are considering it, like vet to vet or vet to administrator or vet to shelter personnel? Just like if someone wants to try to pitch it to their shelter, what would you suggest?
I think even though money's not the most important thing, it does make a really big difference. Hey, we can maybe save more animals, even though it costs more upfront, seemingly, right? Like we have to purchase this expensive drug. As long as we're careful about our case selection, we can treat these animals that may currently be being euthanized because of the, challenges of care, or that are currently clogging up your isolation space for a week to a week and a half. Maybe you can be successful and move them along and literally save more animals, which is, priceless.
I would also add that, while CPMA can really improve, and move animals along more quickly in your shelter, just maybe evaluate like what resources you have available in your community. Like it doesn't if you are struggling with the upfront cost of it, think about, are there other organizations that have access to this, partnering with them, working on an outpatient, type approach, just to avoid, all of that going through you, the shelter that already is over capacity and overwhelmed. So, just because you cannot take this on board, I think I'm sure you are all already doing this and exploring your partnerships already. But get a temperature check on the other orgs and see how you can work together. If you administer and then maybe they isolate, sort of working together and collaborating on how you can integrate this into your community, not just your shelter.
Oh, can I add something? Is that okay? We just a thought, especially if, buying a box of this to begin with is a bit above what you want to do, because it comes in, I think, like 6 vials. Yeah. And that's a lot of money up front for some organizations, but you might be successful getting another veterinary clinic or like an ER to sell you a bottle for a particular animal as a way to try it. And we actually did that because we were one of the only clinics in the area that had it initially. And so, there was some reciprocal there. If we're short on it, we can always ask, if we have 3 parvo dogs come in, like we did a few weeks ago, like you might need some, and then you can kind of loan back. And so we just as vet to vet have done that. And it's been a way to kind of share the load a bit. It doesn't share the treatment load, but at least the financial load.
And y'all correct me, my most recent like Google search was that it's about $1,200 for 6 vials, which is like one box. And that's from the vendor. Is that what y'all are seeing?
Sounds about right. I want to
Yeah.
say maybe 13, but yeah.
Yeah, I've seen it at 13. I think now it's like just 12. Yeah, something like that.
Okay, yeah.
And the approximation is that one vial can treat about an 11-pound dog. So let's say like so you can, if you have 6 vials, you could treat 66 pounds worth of dog. So let's say to treat an 11-pound dog would be about, what is that, $200? And that's without any markup.
Right.
But then if that shaves off, 3, 4 days of treatment and hospitalization and care, it's it does end up for us being way more cost effective than, of course, sending off to our ERs that we partner with, and we pay, like 2,000 a day for a night, sorry.
Right.
Yeah.
Yeah.
If you'll check out that paper that was published, we dropped the link in, you can see they have like a really handy chart in there that's their cost breakdown for how much it would cost to treat with just supportive care versus CPMA, and then their breakdown of how using CPMA actually ended up costing less for them in the long run, just because time in ISO time in treatment was shortened. The other interesting part that the paper mentions is that they didn't look at, like they didn't compare individual treatments needed for each individual dog in the CPMA group versus the non-CPMA group. So that actually could contribute as well. Maybe CPMA treated dogs don't need as much anti-nausea or pain medication. Who knows? So that could also affect the cost. Anything else, docs, before we jump into questions? Because I know we had a lot of questions. Let's
Thank you so much. It was really interesting for me to hear about just how much the shedding actually is decreased. I know that this year has been really hard for Parvo. So yay, I'm excited. We have a lot of questions. The first one is kind of a request. So do you guys have any written protocols that you can share? And this will be my little plug. Maybe we can share that on Maddie's forum. So any questions that we don't get to today, we can definitely answer over there. So if any of you have any, that would be fantastic. And then a few other questions. How do you all determine parvo exposure within the shelter? So I know you all talked a lot about litter mate exposure. Is there any other considerations there?
Yeah, that's a tough one. It takes a moment of clarity and calm to sit and have a think about it with everyone. Um, Typically, when we have a case that, let's say, we didn't get at intake, we didn't catch at intake, and they broke with Parvo a couple days after intake, and they've gone to play group, and they were in this room, and they went to this room. We sort of, well, we pause all movement, we stop everything, and then we start a risk assessment. So that just involves this big, wonderful spreadsheet that auto calculates some, vaccine dates, exposure type, and basically, whenever we think that an animal may have come into direct contact or been housed in the same room, that's what we as a shelter consider to be exposed. It can look like a variety of different things also for other shelters, though. It depends on your biosecurity, your operations. But that's typically what we use to assess exposure. So were they in play group? Were they on the same surgery table? Were they housed in the same room? Things like that.
We're very similar, although I like this spreadsheet idea because usually I'm the spreadsheet and I'm like looking at every every animal and doing that risk assessment. Um, but anyway, the same idea. And if we're all lucky, then they didn't get all the way to surgery, and then expose a whole room of surgery, or all the way to an adoption event, something like that. So it really is just, tracing the movement of the animal and which animals they may have come in contact with, and direct physical contact or likely, um, transmission and through a fomite or something is what we look at mostly.
I feel like it's always the one potentially exposed animal that experiences no bottlenecks in your system and went all the way to the adoption opportunity. So I definitely feel that. I know you all talked about clearing cases, so around you said 5 or 6 days, and then 2 tests. Are you at that point considering no more isolation is needed? The specific question, let me read it. How do you determine length of time that ISO is required? Is there a standard on CPMA or is it case by case?
I'm
Hard
sorry.
questions, yeah.
Yeah. May um I'm sorry, like I was also trying to reply to something else, so I fear I didn't listen very carefully and I am just
Okay.
sitting here like looking like an idiot.
No, no. So how do you determine the length of time that ISO is required? Is there a
Okay.
standard on CPMA or is it case by case?
Well, it sounds like Dr. Tamimi has a standard. We have been doing like, retesting after they've been in there a week as long as they're doing well, but that's because they're generally feeling pretty good at that point. So I don't know, maybe she has a better standard.
I mean, I don't know if it's better, but we test once clinical signs resolve. Whether like what exactly that means, like are their feces still mushy? That's maybe it's a bit unclear, but I would say if they're bright, if they're eating a bit, if they've not been vomiting, then we will test more quickly, I would say. And we do seem to see resolution of the shedding pretty quick. So that would mean, once they do have those two negative snaps 24 hours apart, then we can move them out of isolation. There isn't like a day 5 we test. It's really based on that individual dog. So each animal is assessed daily, and once they start feeling better, we try to get things rolling.
Yeah, I think that's the really exciting part, especially when isolation is so limited in so many areas, right? Being able to reintegrate to general population as quickly as possible. The next, I know we're kind of short on time, but we had a few questions relating to foster care. So we've kind of been talking about treating animals within the shelter, but would your protocols change, or is there any insight into maybe foster retention or anything like that with animals that do receive CPMA versus not?
I feel like so we treat as many as we can in foster care as long as they don't need to be hospitalized, right? So, they come in and they're super dehydrated and I feel like they're likely going to crash pretty soon. They're shocky, that kind of thing. Those will keep, and then maybe they go back to foster care after a few days. But it's great when we catch, these kittens look a little, and we do a parvo snap and they're positive, but they're otherwise still willing to eat, maybe a little, they're still in reasonable shape. They're still ambulatory, that kind of thing. And same for outpatient care with an owned animal, or an adopted animal. If we don't feel like they need to be hospitalized, we're happily treat them and send them out and just see them daily with a planned appointment until we feel like they're doing well. so that we can control the circumstance, around their coming back to the shelter. Um, so I would continue that. I mean, I think it would be if you have an all foster-based organization and you did have an animal that needed to be hospitalized, then it would be more of a challenge, right? Then you'd be looking at sending them somewhere. Um, but it can certainly be successful for many of the patients that we see.
Anything to add, Dr. Tamimi?
No, I think you summed it up, Dr. Fuller. We struggle a little bit getting dogs out to foster with Parvo, same for Panlo kittens. Um, but any chance that we can get to administer whatever treatments we have in shelter and sort of get them set up so that they are stable enough to go home, um, is great. That's what we would want to do so that they don't have to be housed in the shelter. It doesn't happen that often. We try. And I think that comes down to, getting foster buy-in and really training and supporting them and helping them feel supported through that process. So I'm hoping that will change soon, but yeah, we do struggle with fosters at the moment in terms of, these infectious diseases. Same with ringworm. We don't have great success with that.
Our little fungal friends. That's
Yeah.
interesting, Alex. Well, thank you so, so much, Dr. Aziz, Dr. Fuller, Dr. Tamimi. This has been really insightful, and I'm really excited to see where this leads us. Like I mentioned, our panelists will be available on Maddie's forum to answer any other questions we didn't get a time to share. So please feel free to hop on there. We're going to share the link in the chat, and I want to leave with a little reflection question as I recommend you all visit Maddie's forum. What challenges or barriers do you anticipate in integrating CPMA therapy into your shelter's parvo management?
Thank you so much, Deborah. Thank you, doctors. This was incredible. It seems we had a snowstorm over here as you were speaking. So I am so grateful to spend this last call of 2025 with you all. Thank you, Deborah, for being an incredible host throughout December. And for folks joining us, please know that the next few calls are canceled for our winter break, and we'll be back January 5th for a great conversation with Lulu Ochoa and Shanye Johnson to talk about Get Them Out Even for a Little. And if you're interested in hosting or if you're interested in speaking next year, definitely let us know. We'll drop a link in the chat, and you can also email me directly at communityconversations@maddiesfund.org. But thank you so much for such an important conversation. And Deborah, thank you so much for always bringing so much joy and wisdom as well. Thanks, everyone, and have a wonderful holiday break.
Bye,
Thank you
everyone.
all.